Rethinking the paradigm of medical care. After I've been in Vietnam for a little bit of time, and I've done rotations in hospitals around the world, I'm wondering if our American medical system works well. See, it's funny, there's two different worlds we have in the US. It's called primary care or clinic, and then it's called hospital. And then when we think about patients and their issues is completely opposite, actually. So if you're in a hospital, we presume you have something serious, life-threatening, unless proven otherwise. And we do lots of testing to make sure you don't have all these serious things. And we want to talk about resources. We're not great stewards in the sense of having lots of tests that come back as positive with results that are useful. I may see maybe 1 in 10 CT scans that show a clot in the lungs, which is good to know. But my colleagues in the emergency room are the ones who order those usually. They may see 1 in 100, which means they order 99 tests that are just wasted, useless. They give you IV contrast, they give you ionizing radiation, they cost lots of money, take up resources. But we think differently in the hospital. We think, wow, we gotta make sure this guy has nothing serious, because if he doesn't, then we can send him on his merry way. But our friends in the clinic think differently. They presume everybody's healthy until proven otherwise. And that's why you hear so many stories of people who go to the doctor, they say, oh, don't worry about it. You know, your leg hurts, get some therapy. And then it makes the, local news, shall we say, this guy, the doctors missed his lung cancer. He felt bad, but they said just walk it off, give him some pain medications. They never thought it could be something serious. Sure, we talk about screening. They're supposed to do a physical exam, talk to you, all that stuff. And that's very useful if you actually do it. But apparently the doctors in clinic don't have any time to do that. So it's not done. So why don't you just order tests like in Asia or other places? Hey, your knee hurts? Oh, let's get an ultrasound. Let's get an x-ray. Let's get a CT scan. How about MRI? And then it all comes back as normal. They're like, okay, let's get you the therapy now. There's nothing wrong with you. Of course, it's putting the onus on the radiologist or the person reading these studies. But I think that's still better because those tests are better than some doctor who doesn't really examine you or doesn't know how to do exam. Or doesn't even listen to you and ask, hey, how long's been going on? Oh, okay, a month. When actually it's been years, right? But I think to rethink the way we do medicine requires a lot of stuff. It requires us to actually question, why do we do it two different ways in a clinic versus the hospital? We say, well, the people who go to the hospital are sicker. Well, I don't know if that's true. People go to the emergency room for many different reasons. I would say one of the biggest is, hey, I can't get in to see my doctor. They don't have any openings for the next, I don't know how many months. Or my doctor put in a referral for me to see the specialist, but I haven't gotten a call and I don't know when I could see them. Or I'm supposed to get an MRI, but they haven't scheduled me, so I'm just here to see you in the emergency room. Urgent care, emergency room, they're basically primary care nowadays. So going back again, why do we treat it differently? We say selection. Who is selecting? The patient? So you're saying now they know something is more serious and that's why they go to the emergency room? I would say that's completely not true. Basically, whether you go to the emergency room or not, depends on how urgently you feel you need to be seen and how much patience you have. And I would say many younger people go to the emergency room because they have no patience to wait for their doctor. And most of them have nothing wrong with them. Many older people go to the emergency room because they don't really have a way to go in to see their doctor. They can't really walk. It's really hard to get to the clinic. They have no way to help them. Just call an ambulance. Some doctor will see you shortly. That doesn't sound very scientific, medically based. Who is the one triaging? No one? It really boils down to cost, I would say, in the US. Insurance companies don't want to pay money, right? Is it better for the patient to make sure you don't miss that 1 in 100 cancer of the leg when it would have been missed for years? Would have been better if that lady who I saw in her 50s got diagnosed with stage 4 pancreatic cancer, who years ago complained about back pain. If she got an imaging study, could it have shown something back then? If the radiologist had good eyes, even though they got the spine, could he have seen something in that pancreas if they did an MRI? Possibly. Would have given her many more years to live. How do we think about medicine? If it's about the money, then we should just say it. We should talk about it. We just say, hey, can't afford to do that. This is the US after all. We have insurance companies. They need to make some money. So what is it about? Why do we have a different system? Are our doctors just as cursory as the ones in Asia who don't examine you and just say, hey, order a test? They lay hands on you, right? How often do they hear something that's significant? How often do they do an exam and figure something out? I don't know, but supposedly it's really high. They diagnose many things by these things because they don't order studies, from what I've been told and from what I see. Is that good? Is that the right way? Can we learn from other countries? Can we do it better? I think we can. But hey, who's going to change it? Who's listening?